Okay, I'm back. Sorry, guys. I got some of my water, flavored water. Okay. Um, so basically, I'm just on my Dilaudid pain medicine. They also gave me out of surgery Gravol because they're in there doing stuff with your stomach. It gets upset. So gave me Gravol. I did feel nauseous. They did tell me a little trick. They gave me some of these. These are alcohol swabs. You've probably seen these like in first aid kits and that kind of thing. The nurse told me if you sniff an alcohol swab, it's supposed to help relieve your nausea. And I did it in the hospital, and to be honest with you, I think it kind of worked. So that was an interesting tip. They did give me Gravol, though, as well through my IV to also help with the nausea. So I don't know if it was more that or these, but, you know, it might be worth it just to keep some of these in your purse if you're ever out and you kind of feel sick. Just saying, you know, until you can get some medicine or whatever. It might work. I don't know. Don't know. So, yeah, day 2, pretty much, so this would have been Tuesday, the day after, or sorry, day 1 was Tuesday, the day after surgery. And like I said, just allowed water, writing it down on here, going for a walk. They want you walking up and down the halls, you know, as far as you can go, a couple times throughout the day. They also want you sitting in a chair. There's a chair in your room. They want you sitting, not just in bed the whole time lying down. They want you up and sitting and doing things. So that's the day after surgery. And that's pretty much it for the day after surgery. Again, like I said, I did nap a lot because that anesthetic it stays in your system for a few days. So I did nap a lot. I was going to the bathroom regularly, urinating, I should say. I should also say TMI, you guys, this is medical stuff, so there is going to be some gross things in here. I apologize, but I want to be as open and honest with you as possible. I still had not had a bowel movement, and I honestly really hadn't because I was on this high protein liquid diet 2 weeks before surgery. So we're going on about, 3 weeks here without a proper bowel movement. So that's fine, but I'm urinating fine. Marking down all of my measurements and stuff on the little whiteboard for the nurses, doing their job for them basically. But whatever. Now, day 2, what they call day 2 is day 2 after surgery. So this was Wednesday. Okay. This is the day where you move on to stage 2, which they call low sugar clear fluids. This is what they call, okay? So what I'm allowed on day 2 after surgery is 30 to 90 milliliters or 1 to 3 ounces of water or clear broth or sugar-free Jello or herbal tea per hour. Okay? And then the reminder, stop sipping as soon as you feel full. Never force yourself to finish. Okay? So this is what I was allowed to have. So on this Wednesday is the day that they brought me. I'm wrong. This is Tuesday. This is the day after surgery. I apologize. So day 1, they do consider, no. You know what? Things are messed up here, you guys, because I was supposed to be in the hospital for 3 nights, okay? So 3 nights, 4 days. That's why I'm getting confused. I wasn't in the hospital for 3 nights, 4 days. They discharged me early. So my days are getting confused. So I'm just trying to think. Yeah, they rushed me through stuff. I'll be honest with you. They did rush me through. I feel very fast. So day one was Tuesday. I was allowed the water. Surgery day, allowed nothing. Day after Tuesday, allowed water. Day after Wednesday, I was allowed stage 2, which was low sugar clear fluids. Now, like I said, they brought me, because now they're bringing me food trays, okay? Now, I had stated before that I'm vegetarian. I don't eat Jell-O because of the gelatin. I only have vegetable broth. I won't do beef or chicken broth. And when it comes to protein shakes, when I can have those, I need a milk alternative to mix it with. I won't do cow milk because it makes me sick. So I had talked to a plethora of people. Even before I got to the hospital, when I was doing bariatric classes, I let all of them know. I let them know when they called me to tell me the instructions on what to do to get there for surgery day. I told the nurse when she was admitting me and asking me all these questions that these are my dietary restrictions. When I was waking up in recovery, I told them again. I told them again when my nurses came in my room. Like, I must have said it at least a dozen times to at least a dozen different people. And every single one assured me, not a problem, everything will be fine, absolutely, we'll call down to the kitchen and get your stuff ordered, not a big deal. I was assured by every single person. Every single one said not an issue. Every one. So when they brought me my breakfast tray, all I had was herbal tea. It was chamomile, herbal tea. I'm not a huge herbal tea fan to begin with, so I did not enjoy it. But I did sip on it because I'm supposed to. That was my breakfast tray. My lunch tray, they brought me herbal tea and vegetable broth, which honestly I was excited for because I was kind of hungry. Now, I don't know what they did. Now, I'm one of those weird people who actually enjoy hospital food. I've been in the hospital here in Saskatoon a few times, and I've really enjoyed hospital food. I've never had an issue with it. I don't know what they're doing in Regina, but the veggie broth was so salty. It literally felt like I was licking a salt lick. It was inedible. Absolutely inedible. I tried. I got a couple little teaspoons in. You guys, I couldn't. It was so bad. And the herbal tea was also bad. It was so bad. So that's what I had for lunch and again for supper. It was so bad. It was so bad. Then they came, and don't forget, I'm still filling out my little sheet here. I'm still filling it out. So, yeah, still filling this out. So yeah, I'm just looking here. I wrote down a date. So surgery was Monday, April 25th. Stage 1 was Tuesday, April 26th. That was the water. You know, it's funny here. I wrote down the dates. Thank God I did, because I'm like, this isn't adding up. On the day after surgery, the Tuesday, that's actually when they started me on the broth and the tea. So they already rushed it, because according to my other sheet here, they weren't supposed to start me on the broth and the herbal tea until Wednesday, but they pushed it. They started the same day. So it was in the afternoon they started me on the broth and the tea. So they're rushing me through it, which I don't think is proper, but that's fine. So Tuesday, the day after, was stage 1 and 2. Wednesday, the next day, so that was Tuesday. So I'm having my herbal tea, my broth, my water. I'm walking, I'm sitting in my chair. I'm not sleeping as much, but I'm still sleeping quite a bit. I still have my IV. I still have my leg compression things on when I'm in bed. And it's just everyone's so, nobody knows. You ask the same question to 3 different people, you will get 3 different answers. Honestly, nobody knows what they're doing. I'll be honest with you. No one knows. I think it was the Wednesday. I'm still wearing these stupid compression things, and I think I asked the nurse or something about them, and she was like, oh, you don't need to wear these anymore. If you're walking, this is only if you're not walking yet. You don't need to wear these. No one told me that. Why would they? So I took them off, and she disconnected them and took them away. I was walking on day 1. On surgery day I was walking. So why did I have these things? Like, whatever. So that was fine. Wednesday, they came to me and said, we're moving you to stage 3, because I was tolerating the liquid I was getting in. I didn't have any discomfort. I didn't have any pain. I didn't have anything. So they moved me to stage 3 on Wednesday. Now, stage 3, low sugar, high protein liquids. You're allowed half a cup of high protein shake. And then they have, conveniently here, located in the galley kitchen across from the nursing station. You're allowed 1 to 3 ounces of water or regular broth or sugar-free Jello or herbal tea per hour. Stop sipping when you feel full. Never force yourself. So here's the thing. When they bring me my breakfast, lunch, or dinner trays, they have tea and broth on there. Now, according to this, it says one or the other. You can't have both. But yet they bring you both. Like, it's very confusing. They don't give great direction. They do not communicate well. It's horrible. But like I said, I wasn't finishing anything. The broth was inedible. I'd have like a sip or 2 of the broth and a sip or 2 of the tea, and that's pretty much all I was taking in besides water, because it was just gross. So the nurse came in and said, yeah, you can start your high protein shake. We've mixed it up. It's in the fridge in the galley across from the nursing station, just down there. And then she goes, if the door is locked, just ask one of the nurses to open it for you. Thanks. I should also say, let's back up a little bit. I forgot about this. So, had surgery Monday, then Tuesday. Tuesday night, 10 p.m., I was sleeping in my private room. Sleeping at 10 p.m. One of the night nurses, which you know how much I love the night nurses, came into my room at 10 p.m., woke me up, and said to me, Melissa, you need to wake up. We need to move you. What? So, I wake up, I don't quite understand, right? I'm kind of groggy from anesthetic. I'm kind of groggy because I was sleeping. It's 10 p.m. at night. I'm comfortable. I'm resting. Why are you waking me up? We need to move you. We need this room. What do you mean you need this room? I've been in this room since yesterday. I need this room. We're moving you to a double room. What that means is they're moving me in with somebody else at 10 p.m. at night on a Tuesday when I was sleeping peacefully. This is when you choose to move me? You couldn't have done it during the day when I was awake? Like, I'm sorry. I was so mad, you guys. So mad. And all I can think is, I don't want to move in with another person. Like, I like my room. I'm comfortable here. I have my own bathroom. I've got my own routine of how I do things. I don't want to be moving. What are you talking about? So I'm so mad, and I'm like, well, can I use the bathroom? Like, and he was like, oh yeah, take your time. No rush. Take your time. So I'm like, okay. So I get up and I go to the bathroom. And I went to the bathroom. The other thing is, the day before, because my mouth, remember, was so dry, I actually asked the nurse if they had a toothbrush and toothpaste. They did. And I brushed my teeth the day before, which, oh my God, amazing. I highly recommend. If you're in a hospital, ask for a toothbrush and toothpaste. It makes the world of difference. So I went to the bathroom. I brushed my teeth, right? Because I don't know what room I'm moving into. I don't know what the situation is. So I brushed my teeth, went to the bathroom. I wasn't in there very long, like maybe 5 minutes, maybe. And don't forget, this night nurse told me, take your time. We're in no rush, right? I opened the door to the bathroom to come out. They've loaded all my stuff, my suitcase, my clothes, everything on my tray table, and they're wheeling it out. And I'm like, I feel like I'm getting thrown out. I'm like, you told me I could take my time. You told me this wasn't a big rush. Apparently it is. So I'm upset to begin with. And then I see them taking my stuff out. And I'm like, I felt violated. I don't know. It was very rude to me. Like, I just had surgery and you're throwing me out like trash. Like, I was mad. So this night nurse, this little guy, like 5 foot nothing guy, night nurse who told me they're moving me, is standing there and he's already stripping down my bed, like already. And I'm like, and I was in room 7. And he says to me, it's just down 3 doors in room 10. And I'm like, and I'm just looking at him. I'm just looking at him because I'm mad. And he's like, can you walk? And I'm so mad, you guys. I looked at him and I said, I guess we'll find out. If not, you'll be picking me up off the floor. Like, I was so mad. And he's just like, well, you should be able to walk by now. I'm like, guess we'll see. So I'm slowly walking down the hall and I'm fuming. I'm so mad. It's 10 o'clock at night. Most people are sleeping. The rooms are all dark. I kind of walk down. I see number 10. I walk in and there's like a bed over here with the covers drawn back. And then there's an old woman in another bed there with the curtain half drawn, because now I'm in a room, so there's a curtain, right? A curtain half drawn, and one bathroom for both of us, which happens to be on her side of the room. So when I need to use the bathroom, I'm literally like 2 feet away from her in her bed. Now, don't forget, this is 10 o'clock at night. She's sleeping. So she doesn't know there's someone new in her room, right? Like, just horrible. Just horrible. So I'm just standing at the door. I'm just standing at the door because I'm not 100% sure. Is that my bed? Is that not my, like, I don't know. So then this stupid little night nurse comes and he's just like, here you are, same room, same everything. And I'm like, looking at him like, this is not the same room. This is not the same everything. Number one, in my private room, my bed was on the other side of the wall. I was facing the other way. Now I'm facing a different way. The window in my private room was nice and big and beautiful. I could see the sunsets, the sunrises. It was gorgeous. This has got a much smaller window with a worse view. Like, no, I was not happy. So he's like, there you go. And I was like, no, you're not getting away from this right now. You woke me up at 10 o'clock of the night to move me. I'm sorry. I said to him, I said, I need fresh water with ice. I need pain medicine. Because I was sleeping peacefully and you disturbed my slumber. So get to work. I was pissed, you guys. I was so mad. And he gave me this look like, are you kidding me? And I just stared at him and I'm like, you better get me my shit. Sorry for the language, but I was so mad, you guys. Fine. He got me my fresh water. He got me my pain medicine. Got into bed. Went to sleep. And normally they come and take vitals throughout the night. You guys, I did not get disturbed all night long. Did not get disturbed. They left me alone because they knew I was mad. Night nurses, horrible people. If you're a night nurse, I sure hope you're better than this because these ones were horrible. Horrible. Fine. Wednesday, as I was saying, they come to tell me I can get this protein drink. Tell me where it is. Open the fridge. You'll see a bottle with your name on it. That's all for you. Again, I'm still drinking out of these little paper 1 ounce little cuppies. They're not even an ounce. They were like 30 mils. Is that how much an ounce is? I don't know. It seemed small. It was really little. So as soon as she tells me this, now don't forget, I've talked to at least 12 people to tell them milk alternative, right? Don't forget. So I go down, all the way down to the galley kitchen. There's the nurses station, which I would say about 8 nurses, all just gabbing and talking. Some sitting on the desks, leaning on the desks, just gabbing. So I walk right by them. The door to the galley kitchen was open. I walk in, I see the fridge, I open it. Now, I just had bariatric surgery. I haven't eaten solid food for over 2 weeks. I open this fridge. It is full of food. Everything. Sandwiches, cookies, fruit. Everything's got labels on it. Different patients' names on everything, you guys. And I see 3 jugs. They had asked me if I wanted vanilla or chocolates. That was my choice, vanilla or chocolates. I chose chocolates. There were 3 bariatric patients on this floor who all had bariatric surgery on the same day I did. I was one of them. There's 2 other people who had the same surgery as me on the same day. There's 3 jars, 1 vanilla and 2 chocolates. So one of them picked vanilla, the other one picked chocolate like me. I find the one with my name and I'm looking at it and the label says, my name, lactose free. That's what the label says, lactose free. Well, lactose free is not dairy free. It's still cow's milk. I looked at the other 2 labels with the other patients' names. They both said lactose free as well. I was hoping maybe they made a mistake and mixed mine up with the other girls. Nope, they all say lactose free. So I'm like, okay, well, whatever. So I fill up my little paper cup with this lactose-free protein shake. Put it back in the fridge. Take my little cup all the way back down to my room. Sit into bed. Take a sip. Definitely cow's milk. So I'm like, okay, what am I going to do? So I sipped it. The 30 mils, that little paper cup, I sipped that whole thing. And not instantly, but within the hour, my stomach started to feel really sick. Now, some people might say this is in my head, whatever. You got to understand, I haven't drank cow's milk in probably 10 years, okay? I have had it in baking, that kind of thing, before, not a lot, because when I make my own stuff, I always use a milk alternative. But like if my mom made something, it's got some cow milk in it or whatever, if it's baked or whatever, I have had it, and that's never affected me. But just to drink straight cow milk, haven't done it in at least 10 years. My body's not used to that. Combine that with a surgery that involves your stomach and all that kind of stuff, it's not going to be a pretty situation. So at this point, the nurse comes in to take vitals. And she says, oh, good, you found your protein shake. And I explained to her. I said, yes, but I requested a milk alternative. This made me very sick. I can't drink this. And she says, oh, okay, well, I'll call down to the kitchen. We'll get this straightened out. Great. Comes back. Sorry, we don't have milk alternatives. You're a hospital. Like, are you telling me out of all the patients in your hospital, you've never run across someone who needs a milk alternative? I didn't care if it was soy milk, almond milk, cashew milk, oat milk, rice milk, hemp milk, whatever. I just can't have an animal milk. They had nothing, you guys. She's like, no, we don't have anything. We just have cow milk. We don't have any other milks. How can you not have any other milks? You're a hospital. Like, you need to... Everyone has some type of dietary, not everyone, but most people have some type of dietary restriction, whether it's, gluten-free, whatever. Like, you've never run into this? And I was mad because I had done my due diligence. I had made it very clear, even when I was in classes, that I needed a milk alternative. And not one person told me that would be a problem. Everyone said, no problem, we're a hospital. We deal with many different people. So I felt pretty confident because I had spoken to like 12 different people who give me the same answer that, hey, maybe they'll actually get it right this time. I had even told them ahead of time, look, I don't want to piss anyone off. I don't want to make things hard for anyone. If you don't have a milk alternative in the hospital, I'll bring my own. Because I can buy, almond milk or soy milk in cartons that don't need to be refrigerated until opened. I can bring that with me to make it easy for everyone. Like, I was trying to be accommodating. Do you know what I mean? So I didn't do that though, because everyone assured me it wouldn't be a problem. So then it's like back and forth. Oh, well, I'll call down here. I'll check down here. They had a Shoppers Drug Mart attached to the hospital for pharmacy. They're like, I'll see if they have anything. They didn't have anything. No one seems to have anything. And then I was told numerous times, the dietitian's going to come talk to you. Great. Dietitian never came, you guys. Never came. They kept saying, did Darren, the dietitian, come yet? Nope. Oh, he must be busy. I'm sure he'll be here soon. He never came. He never came. And I was so mad. And I had told them, because of my situation, that when I was discharged, I'd be staying in a hotel in Regina until Saturday. So they knew I'd be there by myself in a hotel. And the nurse came to me and said, so you're staying in a hotel. How are you getting your protein if you're staying in a hotel? And I said, well, I brought my protein powder. I just need milk. And she was like, oh, you have your protein powder? Like that was the issue? And I'm like, yeah. And she goes, oh, so you just need the milk. You don't need us to mix it up for you. And this didn't make sense to me because I'm like, you guys obviously had the protein powder and the lactose-free milk, and you obviously mixed it together to make the shakes for us. So all I'm asking you to do is take that protein powder and a milk alternative and make me a shake. But apparently, because I had my own protein powder, she thought that would be the answer. It's like, no, the problem is the milk. You don't seem to have a milk alternative. She's like, oh, I didn't know you had your own protein powder. Let me see what I can do. And she came back. She's like, yeah, sorry, we don't have any alternatives. And I'm like, Well, what am I supposed to do? Because you have to hit certain milestones in order to be discharged from the hospital. You need to hit certain milestones. One of those milestones is you need to have a bowel movement. And another milestone is you need to tolerate your protein shake. Well, so far I haven't had a bowel movement, and I can't tolerate a protein shake if I can't drink it. So she says to me, she's like, well, could you mix it with water? Which really is completely not the point, because the point is having the milk and the protein there to give your body something. Mixing it with water isn't going to really do anything. But I was like, yeah, I suppose I could. So, because I can't lift anything, I asked her to bring my suitcase over. I took out my protein powder. I took out my shaker cup because I brought it because I knew I'd be in a hotel and I would need it. I went into, put my water in, put my protein powder in, shook up my shake. I took a sip, you guys. It was the most disgusting thing ever. Like, I almost would rather have the super salty inedible broth than drink this protein shake with water. It was so gross. But I took a little sip, like maybe 10 mils, little sip. And as soon as I had done that, boom, the surgeon's there. Guess why he's there? He's discharging me. He's discharging me a day early, haven't had a bowel movement, haven't properly had my protein shakes, all the milestones I'm supposed to hit, and he's discharging me. At this point, I was so pissed off with the hospital and the nurses that I'm like, just get me the F out of here. Discharge me. I don't want to be here. You guys all suck. It was horrible, you guys. Horrible. Like, it was horrible. So anyway, I still filled out this stupid chart, right? I mean, whatever. So he goes to discharge me. They checked my bandages and stuff. They all looked fine. The nurse I had asked at this point about 3 times, can you take my IV out? So on the Wednesday, my IV, for whatever reason, I don't know why, one of the nurses, they turned my IV pump off. They had taken my pain button away on the Wednesday. They took it away from me. Was it even? No, it wasn't. It was the Tuesday, I think. They took my pain button away. So I didn't have pain management anymore. On the Tuesday, they took my pain button away, the stuff that went in my IV. They still would give me pain medicine pill form if I needed it. And I did have a couple of those on the Wednesday. Apparently, one of the nurses turned off my IV pump. They turned it off. So I'm still hooked up to it, but it's not giving me any fluids. So she finally disconnected me from the IV pump on the Tuesday. But I still had the IV needle in my arm. It was right here. It was horrible. And it hurt so much. And I said about 3 times on Wednesday, I'm like, can you take this needle out, please? Can you take it out? Because it hurts. And they said to me every time, well, we like to leave that in until you're discharged because in case we need to give you something else. And I'm like, you're not giving me anything else through an IV. You're not. You've already been giving me pain pills. What could you possibly have to give me through my IV? But they refused to take it out. When my surgeon discharged me, he was like, yeah, everything looks great, yeah, I heard about the milk alternative, sorry about that. And I'm like, and then he's like, yeah, everything looks good, you're doing good, so I think we can let you go home. And I'm like I said, I was still pissed off. I was like, whatever, just discharge me, it's fine. Just let me get out of here. So that was fine. So gave me a whole bunch of papers for discharge, okay? So this whole thing, I'll go over it with you. So basically, call your healthcare provider, go to the nearest emergency department if you have any of the following: fevers, chills, redness around your incision, swelling in your incision, new drainage, new bleeding, repeat bouts of nausea or vomiting that don't go away. Those are all signs of infection, whatever, right? Then there's discharge instructions. Now, I had my surgery on Monday. This was Wednesday. I was not allowed to shower until Friday, okay? Could not shower. It was gross. On the Tuesday, the day after surgery, I had a really nice day nurse. She brought me a fresh gown, but I couldn't change into it until Wednesday because I was hooked up to my IV and I couldn't put a new gown on because it wasn't the button-up one, so I couldn't get the cords through. But I did change into that on Wednesday. She also brought me my toothpaste and my toothbrush and some towels so I could give myself kind of a sponge bath kind of in the bathroom just to freshen up a little. It felt really good. And I still had from the surgery the dye, you know, that they put all in your belly for disinfectant or whatever. I was still kind of pinky there, so I used the cloth to take off some of that. That was really good. But I'm not allowed to bathe and not shower until Friday. You're not allowed to have a bath. If you still have like your dressings and stuff on, not allowed to get those wet, okay? So you're not allowed to soak your incisions. You can shower when you go home with a clean towel. Pat the incision sites dry. Don't rub, but just pat them. You can have a bath as long as the water level, your incisions aren't in the water, which, I mean, you have pretty low incisions, so. And then it says, leave your dressings on for at least 2 days. After 2 days, you can take your dressings off. You do have steri strips underneath your dressings. It says that those will start falling off at about 10 days, is what it said. And then it says that you can take your steri strips off at the 10-day mark if you want, is what it says in the instructions. Nutrition, continue your stage 3 high protein drink. You are literally on that for the 2 weeks after your surgery until they call you and move you to the next stage, okay? Not allowed to lift anything over 10 pounds for 4 weeks following surgery. At least 4 weeks, could be 6. They want you to keep walking. Every day they want you to walk, and then every day increase your walks. They say it's normal to feel tired after activity. It should get better every day. You guys, I'm on day, I think it's 17. I still get tired from things like doing my hair, having a shower. I still get tired from that. It's like, it's crazy. Medication. They give you 2 prescriptions. Excuse me. One for Dilaudid, your pain medicine. They give you 10 pills of Dilaudid. They also give you a prescription for your Prevacid, which you need to take after 2 weeks. You need to take 2 a day, and that helps with acid reflux because your stomach is different now. So it helps with that. If you take any kind of pills, you're not allowed to take anything except Tylenol anymore. You're not allowed to take any ibuprofen or anything like that ever again, never in your lifetime. It has to be a Tic Tac size. If the pill is bigger than a Tic Tac, you need to cut it or crush it to take it. And then it says constipation is a common problem. You know, feel free to take laxative. And then they talk to you about continuing your medications that you're on, all that kind of stuff. So that's all on there. Now, again, when they went to discharge me, they were like, no rush, take your time. You guys, again, bull. They wanted me out of there quick. Like, I don't know if I got discharged, if they've discharging patients after 2 days is typical now, or if they discharged me because I was a problem patient because of my request of a milk alternative and such. I don't know. But I don't know. So like I said, they have a pharmacy in the hospital on the main floor. Now, I was in Regina by myself. My husband has a coworker that works in Regina. He was nice enough to actually pick me up from the hospital, buy me a soy milk, and take me to my hotel. Very nice. Really appreciate it. It was great. So I had called him. So I called my husband and said they're discharging me. He's like, oh, it's a day early. So my husband had to call the hotel and make arrangements for me to be there a night early. Then he had to call his friends and see if he could come pick me up. One thing I'll say too, if you're like me and you need to have like a small suitcase with you because you're, staying in a hotel or something like that, do not, even if your suitcase is on wheels, even if it is, do not pull your suitcase. Because my husband did that when he had it back in August and he felt it. He's like, that was a bad idea. So I had asked the nurse when she was discharging me, I said, is there a volunteer that can come? Because number one, I don't know this hospital at all. And every hallway looks the same. And I didn't want to pull my suitcase because I knew my husband said, don't do it. So I said, is there a volunteer that can come to my room, take my suitcase for me down to the pharmacy, and then for my ride to come pick me up? Is there a volunteer that can help me? And she was like, oh, I don't know. We're pretty busy. I don't know if there is anyone that can come. And I'm like, okay. And then she looks at me and she goes, well, your suitcase is on wheels. Can't you pull it? And I said, and I was like, I just had surgery 2 days ago. And I said, no, my husband had this surgery in August and he did that and he hurt himself. He told me not to do that. And she was like, oh, okay, well, I'll see what we can do. So she went and called someone. She goes, yeah, we'll have a volunteer here soon. I'm like, great. And she goes, but the volunteer is busy. They can't stay with you in the pharmacy. And I said, no, I don't need her to stay with me in the pharmacy. I just need her to take my suitcase and me down to the pharmacy because I don't know where it is and I can't pull this. I said, after that, she can leave. It's fine. And she was like, oh, okay. And then she goes, you know what? I'm just going to make this quicker. I'm just going to fax the pharmacy your prescriptions. And I'm like, okay. So again, I feel like they're rushing me out. I feel like they're kicking me out. I'm like, okay, like, thanks. So she apparently faxed things down. They gave me more discharge instructions. It just goes over everything. The sutures that are in there are dissolvable, so I don't need to get them removed. So that's fine. It says that, I'm going to have to go to the bariatric clinic in Regina, a 6-week follow-up to talk to them. And then this is just a copy of my voice, life-saving measurements and stuff if something had gone wrong. Here's an allergy record that says any allergies I have. It's basically just copies of everything. Here it tells you what pills to take. So I was on a thyroid pill. It says to continue with that. And then it says, to start taking the Prevacid for 6 weeks. So start with that and then continue my thyroid pill at home. All that kind of stuff's all there. Here's my new medication, which is the Dilaudid, the painkiller medication. Like I said, they gave me 10 tablets. Don't start your vitamins for 2 weeks. So 2 weeks after, it says don't do that. So I didn't until 2 weeks. Sorry, guys, I have to adjust here. And that was pretty much it. And they discharged me. And the volunteer came. She took me down to the pharmacy. And she left me there. The pharmacist was getting my medications. I will let you know the Prevacid. Now, my husband still had quite a bit of Prevacid, so I didn't get that prescription filled. The only one I got filled was the Dilaudid. I also picked up a small bottle of Tylenol, which is all you can have just in case I had headaches or anything. I didn't get that prescription filled there because I had some from my husband. But if you get your Prevacid prescription filled, just a note, it's not always covered by the health plan, and it can be expensive, okay? Now, I was in Regina for this surgery by myself, so I didn't take a lot of money with me. I didn't take my debit card. I didn't take my credit card. I didn't take anything. I had like $40 on me. That was it. And the pharmacist had said to me, this is really expensive. And I'm like, I don't need that one filled. I just need the Dilaudid. So thankfully, the Dilaudid and the Tylenol was about 20 bucks. So I had $20 bills still on me. But keep in mind that if you're getting Prevacid filled, it can be expensive and it's not usually covered by healthcare or drug plans. So just be warned about that. So then my husband's coworker came and picked me up. I told him which exit I was at. He came and picked me up. He was great, took my suitcase for me. He had already went and got the milk. He drove me to the hotel, which was literally a 4-minute drive away from the hospital. I checked in at the hotel. He took my bag and my milk up to my room for me, put it in the fridge, put my bag where I could reach it. Super great guy. That was like the best experience of the whole thing was him. And then he left, and I had a beautiful room at the Ramada Hotel. It was a king-size suite, big king-size bed, roomy, chairs, table, my own fridge, microwave, Keurig, TV, bathroom, had a shower, not a tub, which was nice. It was great. So yeah, that was pretty much my hospital stay. Not great, you guys. Night nurses were horrible. Did not accommodate dietary restrictions, even though I gave them plenty of time and warning and all of that. Absolutely horrible. So if you can't tolerate cow milk, you need to take your own. Don't listen to them. If they say not a problem, we're a hospital, we accommodate everyone. No, they don't. They do not. Take your own stuff with you. And I also recommend even taking your own broth, if honestly, because what they served was inedible. It was horrible. It was horrible, you guys. Yeah, that was, you guys, that was it. That was my experience of the surgery in the hospital. I don't know what else to say about it. This video is quite long, but I wanted to give you all the information. I hope I gave you everything. If anything was confusing, because I know I got some days and stuff mixed up, just give me a comment below if you have questions. If there's something I missed talking about, please put it below as well. But that was my surgical experience at the Regina General Hospital here in Saskatchewan. Like I said, the surgery itself, from what they told me, went well. I haven't had any complications yet. Pain level was minimal. I was up walking right away. The nurses, some of them were good, most of them were not. And yeah, they really dropped the ball with a lot of stuff. And like I said, you could ask the same question to 4 people, 3 people, 5 people, doesn't matter. You will get a different answer from every single person. So what I have learned from this experience is they have no clue on anything to do with this surgery. I mean, the surgeon seems to be competent. He does his job well. Nobody else seems to know anything about it. No one seems to know the right answers. No one seems to know what's going to happen or how things are going to happen. It's pretty much a jump ball, and you are pretty much on your own. There's not a lot of support. They keep saying that there is. I haven't experienced it yet. I mean, I don't know what to say. I've gone through this a couple times because my husband had it in August, so I have his experience. I also had a vertical sleeve gastrectomy in Mexico in 2010, so I have my experience from that. I cannot imagine if I didn't have that experience and my husband's experience on what I would be feeling right now. Like, I still feel anxiety and unprepared and like I don't know what's happening, but it would be 1,000 times worse if I didn't have my previous experiences. So for anyone out there who is going through it, has gone through it, or will be going through it, and you don't have those prior experiences from a close friend or family member, I wish you luck because you will need it. I do have some videos coming up of, me in the hotel room the day I was discharged and following that. So again, if you haven't subscribed yet, please do so you don't miss those follow-up videos. And yeah, we're going to keep talking bariatric. We're going to keep talking about my progress. I'm going to keep you guys coming along on this journey, and I will let you know absolutely every single thing that I have experienced with my experience. So thanks for watching, and we'll see you guys in the next one. Bye.